I'm presenting on the opiate addiction treatment, and I'll be presenting on 2 interventions. My case study summary is Jason Smith is a 38-year-old Caucasian male who is currently suffering the consequences of opiate addiction. Mr. Smith's opiate addiction stems from his physical and emotional abuse as a child. These interventions presented will address individual level counseling and group level counseling in order to encourage behavioral change and promote coping skills. My PICO question was, in adult drug users with an addiction to opiates, is individual therapy as effective as group therapy? I chose the symptom model of addiction approach for his individual treatment. I chose this intervention because it focuses on the underlying causes from their thoughts, feelings, and behaviors. Mr. Smith's unconscious psychological difficulty stems from his emotional and physical abuse as a child. The treatment process will go from attitudinal to emotional change as a result of increased insight to behavior change. Mr. Smith will attend individual counseling 2 times a week, 1-hour sessions for a duration of 90 days. He will also receive medical treatment for detox. In general, the research finds that both group therapy and individual therapy are relatively equivalent in their effectiveness, and it's best to be involved in both types of therapy at the same time. So Mr. Smith will attend inpatient group therapy 3 times a week for 90 days, 1-hour sessions. Inpatient group therapy will consist of 12 patients and 2 counselors targeting substance abuse. Group therapy provides support, self-understanding, guidance, instillation of hope, and group cohesiveness. Group therapy allows the client to express his issues as well as accept criticism from other group patients. By listening to other group members, the client can develop self-awareness. Individual level goals are for Mr. Smith to develop and use a plan to remain clean and sober. By developing a plan, Mr. Smith can stay on track. Objectives for Mr. Smith will gain an understanding of his addiction and awareness of characteristics that he displays. Reading tasks include readings on topics such as characteristics of addiction, codependency, and addiction. Mr. Smith will journal on experiences, self-care, future planning, and coping skills when confronted with triggers. Activities will be presented once a week. Group goals are to be able to demonstrate resolution of codependency and enabling issues. Objectives will be to gain understanding of characteristics of codependency and will determine if he is codependent himself. Tasks include identifying and discussing triggers, as well as different coping skills he can implement when pressured to use drugs. Mr. Smith will identify relapse and the consequences of it. Outside activities include writing lists of self-affirmation, writing definitions of words such as dependency, characteristics, and the characteristics of codependency. Writing out incidents from their own past to discuss with group activity sheets. Activity sheets on enabling and establishing and defending boundaries. Okay. On the individual level, outcomes we will measure are knowledge gained on addiction as well as underlying issues that led to his initial drug use. Counselors will implement drug screenings in order to monitor client change. After Mr. Smith is 90 days sober, the counselor will guide him in finding a sponsor and refer him to a monthly AA-NA group. On the group level, outcomes we will measure are acceptance of his addiction and increased knowledge on addiction. Counselors will implement drug screenings and questionnaire on the therapeutic factors presented in group. And that's it.